noon, there are 1,352 positive cases in Denver, and unfortunately, we've had 66 deaths. Enforcement teams have made contact, nearly 8,000 contacts, and issued 2,600 verbal warnings to people to comply with stay-at-home orders. They've issued 19 citations or orders to close to non-essential businesses. We have some encouraging news for Denver hospitals. We have about 60% bed capacity, and other metro area hospitals have 35% capacity. Denver hospitals have about 70% ventilator capacity, and other metro area hospitals have about 50% capacity. First, we're going to talk about how we are and have been supporting our area's most vulnerable residents under the leadership of Britta Fisher, our Director of Housing. Hotel rooms have been acquired. Recreation centers are being utilized, supporting our area's most vulnerable residents under the leadership, again, under Britta. We are looking at every major city around the country to learn from their experiences. We brought the first guests into our shelter expansion at the National Western Complex last Thursday evening. That extraordinary multi-agency effort came to fruition at the request of our shelter providers and partners as a way to create greater physical distancing for safety of our guests as well as staff supporting them. I will tell you that last week on Thursday, I walked through the shelter as it was opening at the National Western. And I want to first thank all of the staff members and volunteers who are helping this to be a smooth operation thus far. It is our prayers that we will continue to have a smooth operation. We'll continue to keep our guests safe and from the elements outdoors, and more importantly, healthy. The goal is to make sure that we blunt the spread of the virus with our particular guests. Over the weekend, we reached capacity with more than 700 guests because we took the proactive measure, allowing for our providers to configure their existing space for greater physical distancing. We were able to utilize a new location Saturday run by the Salvation Army that was to accommodate additional guests. Right now, we're working toward opening additional space later this week for women and individuals identifying as women at the Coliseum. There's an important point I want to make here. The city of Denver is serving people experiencing homelessness from across the metro area, not just from the city of Denver. Many churches and other shelter options that are normally available in surrounding areas have shut down or closed to prevent the spread of the virus. And we reached out to the hotel industry early and called for help a week ago. And so we also want to thank the governor for his call that he made to the industry today through a letter. What's important to understand is this. The existing shelter system was not designed to accommodate physical distancing. That is why we have sought additional space and capacity. It's also important to understand that we do not have the luxury of waiting, particularly at this time, where there's cold weather events occurring in our city during the beginning of spring. And we cannot wait for the alternatives to magically arise. This work has never been more important in our city. The executive director of HOSA, Britta Fisher, will join us in just a moment, and she will have more details on our efforts to serve our most vulnerable. Next, I'd like to talk about enforcement of our ongoing stay-at-home order and some steps we're taking to ensure proper physical distancing. You may have heard we closed Civic Center Park and surrounding park areas over the weekend. We also closed Red Rocks. And while we are doing our best to create and maintain safe areas for people to enjoy outdoors, our priority must and will be maintaining proper physical distancing. If we see people gathering in larger groups, or we have reason to believe that they will occur, our Parks Department will close the areas as needed. And so we want to give you a heads up about something that's going to happen tomorrow in Denver. 2 Colorado Army National Guard Black Hawk helicopters will be used to transport survey teams near the convention center. So if you see them, listen to this warning. Do not be alarmed. The Guard will be touring locations that will be used as alternate care sites during the COVID response. So tomorrow I'll be joining Governor Polis on a walkthrough of the convention center with the National Guard leadership. The state will likely have the site ready for patients this weekend. For our residents and families who may need additional support, we want to remind you there's help available. You can apply for food assistance through SNAP. That's the Special Supplemental Nutrition Program for women, infant, and children. We have several resources at denvergov.org. We invite you to go onto the website, and we have a COVID information page that you can visit to find out more information. I've heard from many of you concerned about the impacts of this deadly virus on different demographics, and certainly is a concern of mine as well, and how it's hitting particularly communities of color, and particularly the African American community has been disproportionately impacted by the concentration of cases and deaths. I want you to know I've asked the Department of Public Health and Environment to conduct detailed analysis of these disparities. Citywide, we are constantly looking for ways to respond equitably to the crises. We've embedded it in our Emergency Operations Center literally from the very early days of our operations some 6 weeks ago. And when that analysis is complete, I will share what we've learned about the disparities. I know you're anxious for the answer to the question, because I get it from everyone that I see as I'm traversing from home to work and then back home. When will this be over? And I can assure you we are looking forward to that as much as you are. We have begun planning the very early stages to strategize how we will gradually ease the city out of this challenge. But it's also my responsibility to set reasonable expectations. And now, more than ever, we need to stay the course. I need each and every one of you to continue doing the following health and safety protocols outlined in our stay-at-home order. The order remains in effect in Denver, Colorado until April 30th. We should expect it to remain in effect until at least that date in our city. For those of you who are healthy and at low risk of contracting the virus, we need your help. This is an ongoing and urgent need. There is an ongoing and urgent need for volunteers to support our shelters and our residents experiencing homelessness. And so we ask you to please reach out to our partners at United Way Denver so you can join with us, if you like, in helping our most vulnerable residents feel safe and to find shelter indoors. You can go to unitedwaydenver.org or call 211 to find out how you can volunteer and help us at this very urgent time. With that, I want to bring up our Executive Director for the Office of Housing and Stability, Bretta Fisher.
Thank you, Mayor. Before we had this health emergency, we spoke to the need for a healthy, housed, and connected Denver. Before this health emergency, we spoke about how Denver doesn't do anything alone, how we do everything in partnership. And I want to start today by thanking those partners. As the mayor mentioned, on Thursday we opened National Western Center as an auxiliary shelter, and people voted with their feet. They came. We saw more than 200 walk-ups that day, and that type of utilization taught us that we needed to think about how we would decompress the shelters additionally. And so I want to thank our partners at Denver Rescue Mission, who are staffing National Western Center and leading that effort with the support of several contractors and other staff and volunteers. I also want to thank the Salvation Army. They really stepped up on Friday morning when we found ourselves already with more than 700 guests, and how we could quickly pivot to get that physical distancing that the mayor just spoke to and how important that is. And so they worked with us to open up another shelter site at 48th Avenue Shelter and to help get 286 folks last night to that shelter. And so I want to thank again Salvation Army for their efforts. Next, I want to speak to the opening of the Coliseum. We hope to do that later this week. We're working towards that with our partners, including Catholic Charities, Dolores Project, and Gathering Place. So thanks again to all of these partners who are standing with us to figure out how we can provide more and more physical distancing for our guests. We also want to just speak to why these auxiliary shelters are so needed. We really see this as a harm reduction effort, that the more that we can give the spacing and the distancing that people need, the overnight accommodation, the meals, the snacks, the things that they need, the more likely they are to stay healthy and safe And we know in snow events that more and more folks come inside, and we're really pleased from all these partners that we were able to meet those needs and find accommodation for everyone who is seeking it. With that, I will turn it back over to the mayor. Thank you.
Thank you, Britta. And allow you to stay close for questions in just a moment. Let me turn over to Bob McDonald, who is the Executive Director for the Public Health and Environment. He'll share context of Denver's COVID cases and statistics. Bob?
Thank you, Mayor. I just want to give a couple of brief updates in terms of where we are in this journey. We have seen 1,358 cases in Denver to date, about 60 deaths. And that seems like it is some grim news, but what I'm very excited to share is that for the last 3 weeks, since the last week of March, actually, we have seen just a leveling off in the number of cases. There was a spike on April 9th, which caused a little concern, but what we really need to do is look at a 3-day average because of reporting. Sometimes there's delays in reporting. And so when you look at the 3 days prior to the 9th, you can see that the number of cases was well below the average, and then it spiked, and then it went back down. So again, when you look at that 3-day average, it is really leveling off. And I am optimistically cautious about that, but I will tell you that when I look at epi curves of other municipalities, that many others that are struggling with the same thing, to be this far into it, this many weeks into battling this virus, and for it to be leveling it off like it is, I'm very excited and very hopeful about that. And we haven't really even seen the full benefits of the stay-at-home order, because if you think about that, we are 18 days into that stay-at-home order. The incubation period of this virus is up to 14 days. So now that we've gone that length of time, we should really start to see now the full benefits of this stay-at-home order. And that's one of the things that we look at in terms of making decisions about when we start to ease up on some of our orders. That's a very important piece. Is our cases leveling off? They seem to be. Hospitals are not at capacity, so that's some very important criteria, and I'm really excited to start having the conversation about how we ease out of this now in a way that we can still manage the number of cases. With that, I'll turn it back to you, Mayor.
Your mask? And you took my words. All right, we're going to open. Thank you. We'll open up for Q&A at this point in time. Bob and Britta will be here if you have questions that meet there. They're in their area. We also have Matt Mueller, who is the Executive Director of our Emergency Operations Center. Before I take the very first question, let me once again just say to the people of Denver, you can't see this, but I see it every day. There are about 100 city employees in various shifts that man our Emergency Operations Center who are showing up every day, 7 days a week, around the clock to stand on post and to address critical issues as we face this challenge of the COVID-19. And I want to just say thank you to those city employees. Of course, we have thousands more who are about 90% working from home every day to keep the city operational, to follow through on our responsibility to the people of Denver. I just simply publicly want to say thank you to all of them. And to the men and women who can't stay at home, our first responders, frontline employees in the grocery stores, our medical professionals, thank you again. Every night, 8 o'clock, we howl and we light up our city in appreciation for the work that you're doing on behalf of every one of us. So let's go ahead and open the floor for questions. Online? Do we have questions there?
Can you all hear?
Hello?
Yes.
For questions.
Yes.
We're ready.
Oh, hi. Good afternoon. Thank you. At the end of last week, the Department of Health showed the areas that are being hit by COVID-19 very strongly. Some of them are Valverde, Gloveville, Montbello, among others, that are mainly occupied, populated by Latinos. Are you taking any special measurements in these areas to protect everyone, to protect the Hispanic community? Thank you.
Yeah, I can tell you, and I'm going to ask Bob to come up here. He can probably respond. The question really was about whether or not we're taking particular steps to protect those residents that live in vulnerable neighborhoods, or where we're seeing a disproportionate number of positive cases coming forward. We also announced in that revelation last week that Denver Health and Hospital has also moved to open up a clinic, medical clinic, a testing center, if you will, at the Mount Bettel Clinic, and are working to serve those residents at a higher rate going forward. So from that conversation, I also had a conversation with Dr. Robin Wittenstein, the CEO of Denver Health, and if it hasn't opened already, the Pena Medical Clinic will be opening to conduct additional testing in the north side of Denver. Bob, anything else you'd like to add to that?
Well, I just want to reinforce that from day one, we looked at everything, every decision that we made about how we handle this crisis with an equity lens. Every decision that was made. It was hard to identify those strategies that we could use to address these disparities early on because it took a while for the data to come in. Now that the data is coming in, we need to take a look at why those disparities are existing. And once we know why that's occurring, then we can be more targeted in our strategies. And that's a great deal of the work that we're going to be doing moving forward in the upcoming week.
The other thing I will add is that as family members and as members of the communities that are disproportionately impacted, and we know historically that the African American and Latino communities have been more prone to chronic ailments such as hypertension, high blood pressure, diabetes, asthma related, heart disease. Because we know that, and we know that this particular virus preys harder and disproportionately on people who have those underlying conditions, it is becoming upon all of us to be even more cautious about staying indoors, about practicing physical and social distancing, about making sure that our older adults are particularly protected. I'm very protective of my mother. Matter of fact, I've told all my other siblings, stay away from her. Don't even go by and see her. Call her, and we'll get her the groceries she needs and everything else that she needs. But stay away, and they have been. She's been in her apartment for 3 weeks alone because she's had heart disease. She's had some of those ailments, and so we want to protect our most vulnerable as best we can. So it's all of us taking the responsibility, loved ones, family members, neighbors, friends, knowing these situations, we got to do better and making sure we protect one another as well. Next question. Don't be shy. We'll let you go. Got it?
Any more questions?
Are you guys doing anything as you get all the homeless folks in one area? I know it seems like a good opportunity for outreach as far as health resources, mental health resources, addiction resources. Is any of that stuff happening?
Thanks for that question about health services. One of the things that we're really pleased about at the National Western is our ability to have partnered with the Colorado Coalition for the Homeless. And they are having their Stout Street Health Center actually set up a clinic in the site. So they have a room there that they've divided into exam rooms to provide primary health care as well as mental and behavioral health care. They're also doing robust screening outside where they are checking for symptoms of COVID, taking temperatures, and then triaging as people enter for those symptoms so that therefore the folks coming in are indeed folks that do not have those symptoms. Those who are symptomatic are being directed to respite rooms. We now have 227 respite rooms available, and we are continuing to work on our hotel-motel acquisition in order to increase that number. So again, thanks to the Colorado Coalition for the Homeless Stout Street Health Center, we're able to have a robust partnership in providing for the health care needs of those experiencing homelessness.
Britta Fisher, the Chief Housing Officer for the City of Denver. We've been watching a press conference taking place at the City and County Building with Mayor Michael Hancock talking about some of the numbers of COVID-19 cases that have been right in the City of Denver and some of the actions the city has taken as far as making sure that everyone is obeying the stay-at-home order in the City and County of Denver. also talking about the way the city has gone at great lengths to try to help the homeless, a situation that certainly dramatically changed as our weather did Saturday into Sunday. So we'll be having much more on that. I think maybe the brightest moment of that press conference came when Bob McDonald, who is the head of Denver's Public Health and Environment Department, actually used the word excited and hopeful, talking about the way Denver has managed the caseload so far, with the optimistic idea that maybe if we continue with social distancing and all the other rules and regulations of dealing with this COVID-19 outbreak, that the city of Denver may have in fact started to weather the storm. Much more of this is coming up at 4 o'clock. We'll see you then for 4 o'clock at 9 News.
The mayor has been with our social distancing efforts. As I said earlier, you look at other cities across the country that are many, many weeks into battling this coronavirus, and you continue to see this climb upwards with the number of cases every day, more and more cases every day. And we are many, many weeks now into Denver's efforts and already seeing it stabilize. And I think that has everything to do with how aggressive we were up front as a city in preparing for this. And I want to touch just briefly on something that when I say that, I want to reinforce that everyone needs to keep doing what we're doing. I do go to supermarkets. I go to public places that are still open as essential businesses. And unfortunately, I still see some people in the community in which I live that they're not wearing face coverings. And it might be easy to think that as well as one person, I'm just one person, does it make a big difference if it's just me? But if everybody thinks that way, then pretty soon that's going to chip away at our success. It's going to chip away at our goal. So let's be diligent. Everybody needs to contribute by covering up their face as they go into public settings. So.
Bob, I've had a couple questions for you just about contact tracing. Do you guys plan to do any contact tracing at all?
That's a great question. We absolutely are preparing for that and preparing for many other things as we transition into the next phase. That's one of the key components as we start to lift our social distancing or physical distancing efforts. We replaced that broad stay-at-home order with more targeted testing and more targeted quarantining and isolating of people who are infectious. And we've been building up that workforce and waiting for the testing capacity to build up so that we can move into that next phase.
I got a couple of questions, so sorry to butt in, but I've got like 4 questions lined up from folks texting. First one's for the mayor. This is from Kyle Clark. He's asking, are you concerned if Denverites hear that cases are leveling off, that they'll no longer take social distancing and the stay-at-home order seriously?
You know what? Bob mentioned the work we've done here and being very aggressive and very assertive, but we are being successful in Denver and Colorado because the people have followed the orders. And the key for us now is that we do see some daylight. This is not the time for us to let up, folks. This is the time for us to lean in and to put the pedal to the metal, if you will. This is almost like a marathon. By no means are we done, but this is the second of maybe 4 rounds that we're going to have to do. Not necessarily the virus, but of being smart and continue to exercise good common sense when it comes to physical and social distancing and staying at home. So the reality is simply this. This is the time for us to stay home, and my hope is that people do not let up, but that they lean in even harder and even become more serious about staying at home, about being social and physical distancing. Again, the goal has always been to shorten the actual amount of time that we spend at this peak and that we level off and begin to decrease in the number of positive cases that we have. And this is the time for us to be smart about it. So my hope is that but that we get smarter and we get even more aggressive about staying at home and, in fact, practicing social and physical distancing. Yes.
Connor McCormick at Westward wants to know, he says Denver City Council is reading a proclamation tonight calling for Governor Polis to issue a moratorium on rental payments. He's asking if you agree with this call to action.
You know what? Listen, we also have to be continue to be forward-thinking, and I certainly understand and empathize where City Council is coming from on this. I'm not sure the governor has the power to intervene in these private contracts between renters and landlords, but if it sends a message of the importance and the symbolic power of that something needs to be done to give renters a break, then hopefully the entire industry pays attention. There's a whole ecosystem when it comes to renters. The renters are usually the last element to it. They're landlords and then they're mortgage lenders. And my hope and goal is that everybody continues to work together to give that end user, the renter, the break necessary. But landlords also have to have a break on their mortgages, and lenders have to be a partner in that. And I believe the system is beginning to work and comply with that. People are offering breaks and deferral of late fees, and let's hope that continues on. But I certainly understand and empathize where City Council is coming from, because we all know someone who needs a break at this point in time with regards to their rent.
And then I have one from Liz Gilardi at Denver 7. This might be for Britta, but I'll put it out to both of you.
Okay.
She says, I understand Argus is no longer providing security at the Western Center. Why? Is it due to safety concerns?
Yeah.
I'm very pleased to say that National Western Shelter has been operating without any incidents. The mayor's been there, I've been there several times, and it's quite calm and orderly. Our original security provider gave notice and stopped providing services, and I was very pleased to work with a team that was able to so quickly mobilize new and existing resources to ensure that there was no gap in securing the safety of our guests, because we take the safety and health of our guests very seriously. So with any operation of this size and done in this short order, vendors are going to be continuously evaluated and updated as necessary.
I have a question from Steve Steger with 9.
Let me just suggest one other thing with that, and I'm grateful for Britta and the whole team. A lot of folks came together to fill that gap. There are some other security teams that are stepping in to provide the support necessary. We're going to continue to look for that more permanent solution, at least for the duration of this shelter going forward. But we encourage you to call Argus to ask that question, and we'll continue to do what we can to keep our guests safe. Yes?
This question is maybe for Bob. Boulder County has a team of epidemiologists, thank you, following up with each COVID patient so that they can track recovery numbers. They say that they feel that this is a valuable part of people's understanding of this situation. Has DDPHE considered a measure like this?
Well, we absolutely do. We have a number of cases more than Boulder does, so it stretches our resources. But we work very closely with our partners at Denver Public Health within Denver Health and Hospital Authority. When we get positive cases back, we do that very thing. We reach out to do that contact tracing. And as I said earlier, as hopefully testing ramps up, and we are ramping up our workforce to respond to that testing, but that's exactly what we're doing here in Denver as well.
Bob, Alina has a quick question from Denver Post. She says, what city has been the best comparison to Denver as the city is looking at its cases?
You know, I don't know if I can say which city is the best in comparison to Denver. What I can tell you, I think Denver has done the best job in comparison to those that I've looked at. I don't know who's doing the best or as good as Denver is. That's certainly not been my focus. It's not been the focus of this team. Our focus has been to take care of the citizens of Denver, and that's what we're doing, and I think we're doing it very well. We continue to reach out to other cities for ideas. They continue to reach out to us, and we share those ideas. We collaborate, but overall, I think Denver has been a leader. The mayor's been a leader, and I think the governor's been a leader for the state in that way.
Mayor, I've got a follow-up question from Kyle Clark. Are you coordinating with the state to have Denver lift its stay-home order in conjunction with the state? Would you prefer for the city and state to take the same steps at the same time when we relax these restrictions?
You know, one of the things that we have said from the onset is that Denver is such a unique space in terms of the state of Colorado. We're the most dense area in the state. We have chosen to keep the April 30th date on the table for Denver. We'll follow the state, continue to coordinate with the state. If in the event the state on April 26th believe they can begin to loosen up some of the orders that we have for staying at home and what have you, then we'll take a look at the same data to determine whether or not we can begin to do the same thing. But let me just share this, Kyle. What makes this so difficult, and Bob actually touched on this, is not only do we need to see the cases leveling off and begin to decrease in terms of the positive, we need to see more testing occur, but that contact tracing is critical. For us to kind of understand how deep and far this will go, and to help us to better predict whether or not we're going to have a spike, or if indeed we are seeing the leveling off. And until all of that is actually in place and are synchronized, then it's not really practical for us to even look and say we can date for certain that we're going to be able to lift this. We have targets, and we hope we can meet them. We hope we see the leveling off. We hope we see the decline. But God forbid that we still need to come back to everyone and say, listen, we got more work to do. Then we're going to do that, because we believe there's nothing greater than protecting the health and well-being of the residents of this city. Did we get your last question for Bob? Okay. Anything else? Okay. Thank you all very much.